As you had delineated all the different initiatives that the governor has this year in removing people off the waiting list, which we all support. My concern is the monies that are allocated there. In 18-19, there was a supplemental of 55 million, supplemental funding of 55 million to cover some cost overruns. Is that correct? Cost overruns?
Yep.
All right, and which brought the total to 1.64 billion, which is 116 million more than the prior year. So now we're moving into this year, and this year's budget has a line item increase of only $29 million. But it's also my understanding that in this year's payment processing, that will be 53 payments because of 53 Mondays in this fiscal year. And each payment is $34 million, is that correct?
Yep.
So if we're making an extra payment of $34 million just for normal coverage, and our increase is only $29 million, it's like a net reduction of $5 million to that line item. And my concern is, how are we going to meet these initiatives that you had just laid out?
Yeah, it's a good question because it does look a little bizarre. So to the 18-19 supplemental, that supplemental is really primarily driven by the implementation of the non-residential fee schedule that was effective July 1st of 2018. And then the annualization of the residential fees that were effective January 1st of 2018. So as part of those fee schedule changes, though, we do expect to see some leveled expenses in the area of residential rates due to our implementation of the acuity-based scoring for those rates. It has traditionally been an area of growth in our budget, and we're really seeing that those are hopefully going to.
So do you anticipate actual savings then in that residential area?
Yeah, I mean, there is.
Do you have a number?
I do.
I'm sorry, I'm a numbers person.
That's okay. So we are estimating about $40 million in savings in that area. And so I would also highlight that, in the consolidated waiver, which is traditionally the budget driver in this line item, we do transition folks. About between 50 and 125 individuals transition out of the waiver as new people come on. So we anticipate that those coming into the waiver will be a little bit lower cost than those that may be exiting the waiver. And I think what you're seeing in our budget request is also a reflection of our continued investment in the community living waiver, that mid-range waiver that really provides an additional level of support above the person and family directed waiver, but maybe not the large amount of benefits that would come along with the consolidated waiver. And in addition, I would point out, as we had already talked about, the June 2020 budgets being being served through regular attrition in the waiver. I mean, that would normally be about $10 million.
And I guess my concerns are this, and I appreciate everything you're saying, and it sounds like you have looked at a lot of different alternatives. Just the huge increase that we experienced year to year, almost, $116 million increase from year to year. And this year, we're actually scheduled at a net decrease because of that 53rd week. Even with the $40 million, even adding that back, I just have genuine concerns that we're still going to be sitting in a situation where either A, we're not going to be able to accomplish some of the initiatives, or B, we're looking at another large supplemental appropriation coming forward. So do we all feel comfortable where we're at, I guess is.
Yeah, I mean, it's something we're continuing to watch utilization in a lot of these line items. This is one where we are able to control the individuals coming into the program, but our budget is really subject to the utilization of those individuals. So it is something that we'll have to continue to monitor throughout this year.
Yeah, I mean, I have genuine concerns, and I share the concerns that Representative Kruger have. I mean, I have the same people coming into my district office as well. And if we're making not promises, but if we're talking about it, I want to make sure that we have it in the budget when it comes time.